Hey community, this is Dr. 𝗕𝗵𝗁𝘁'𝘀, and I have a very, very special webinar today. And as you can see on the screen, it's a lab case of a 33-year-old woman who basically ended up in a wheelchair. She kind of comes and goes in the wheelchair. It's not like she's permanently in the wheelchair, but she was in the wheelchair. And, she's recovered a little bit. So she just started with me. And I want to go over these labs because there are so many clinical gems that I'm going to go over right now. If you're suffering out there, I want to let you know you can get help. There's a possibility for you to get help. You just need someone that's working in your corner that understands these mechanisms. This is the problem. If you've been damaged by antibiotics or any other kind of damage, whatever you have going on, if you've been damaged by antibiotics or you have some kind of chronic health condition, you need someone that's in your corner that can guide you through these different steps. This is very, very critical. So what I want to go through is this case. She's a 33-year-old female, and I'm just going to kind of go over like what she presents so you can understand, and then I'm going to go over some labs so you can understand like what's actually going on. So she's a 33-year-old female. She's had some labs before coming to me. She's actually been to another functional medicine practitioner, and he ran organic acid test and hair metal test. So I just think there's some basic things that need to be done before you run those special labs. Anytime basic labs need to be ran, basic labs that are very in-depth, which you'll be seeing in a bit. So she has neuropathy. She has tendon pain. She ended up in a wheelchair initially when it was really, really bad. She has a hard time gaining weight, can't gain weight. She feels like she has muscle wasting. She took Cipro for a tooth infection. And then she also had a couple vaccinations in April of 2021. The first one, then the second one that month, just so you can understand. So if you've done any research on vaccinations, is that it's going to increase your immune system. So when someone's been vaccinated, the immune system is already revved up. She's been trying some things on her own, some supplements on her own. She went to a functional medicine doctor, put her on vitamin C and fish oil. The neuropathy has gotten a little better. The anxiety is still worse. The insomnia is very bad. You got to be sleeping. You got to sleep to heal. She's watched a lot of my different videos. She's on the Wahls protocol, which is a really good protocol for diet and eating. Blood pressure, get this, blood pressure is 86/50, which is very, very, very low, too low. She has pounding head, irritable fatigue. She has light sensitivity and sound sensitivity. And yeah, so let's go over this. So this right here, this is the workup that you need, partial workup, and then let's explain what's going on so you can actually understand what's going on if you're actually hurt or damaged or have some kind of chronic condition. Okay, let me get my pen right here. Okay, so let's go into the lab. So I blocked everything off. I'm going to minimize me so you understand. So the first thing that we come up with is, what do we see right here initially is we see white blood cell count is 10.7. Now, this is the lab range. You see this lab range is 3 to 10. Now, here's the thing, is the sweet spot is 5 to 6. That's the sweet spot, 5.5 to 6.5. That's the sweet spot. So what does this tell me right off the bat when she has white blood cell of 10? There's some kind of infection going on. There's still something happening there, but guess what? She's not over lab high, so no big deal. That's not the way you want to approach these cases. If your white blood cell is 7, 8, 9, that's telling you that you have some kind of chronic inflammation going on. Now, I don't know what that is. We're just getting into protocols. I'll keep you updated, but something's there. Right, something's there for sure. The conventional system missed it. Then her current functional medicine practitioner that she was trying to get help with missed this. Now, she also sent me some labs prior. So just to give you some orientation. So these labs are done in January of 2022, okay? And then she had some labs done in October of 2021, and at this point, the white blood cell count was, I believe, 8. So still elevated. That would have flagged me. Now, what happens when you have this elevated white blood cell count? White blood cell count, they produce these things called cytokines, which is basically a fancy name for saying more inflammation. So if you have a high white blood cell count, your body's chronically inflamed. If your body's chronically inflamed, what's going to happen to your tendons? What's going to happen to your brain? What's going to happen to all these different organs in your body? They're not going to work properly, right? So this is why you need to take a guided approach. You need someone in your corner. Now, if you're watching this video, on YouTube, give me a thumbs up, share it. And if you are listening to this podcast, down below, there's going to be a link to this video so you can see all this content that I'm going to be going over. So right off the bat, there's a problem. You can see here neutrophils are elevated. Neutrophils are the ones that are fighting bacteria. So we know that some kind of bacterial problem happening. Now, this is important too. Glucose is 75. The sweet spot is 85 to 120. That's with eating food. So we want to keep a tight regulation. So what does this tell me? This tells me that she probably has some hypoglycemic events. So meaning what? Meaning that her blood sugar drops too low and then it goes high. If you have poor blood sugar regulation, hypoglycemia, this is a problem because you're not getting nutrients into the cells. So you're not getting nutrients into the cell. And on top of that, we have low blood pressure confirmed, 86/50. That is incredibly low. So that needs to be addressed. So far, we have white blood cell count that's elevated, non-optimal. That causes chronic inflammation. The fluoroquinolones attack the tendons. So if you have, if your tendons are damaged already, the inflammation is going to go to that area. If you have a problem with your brain, the inflammation is going to go to that area. It's going to cause those things to come out. It's going to cause the weak link to come out in your brain. So far we have white blood cell elevated, we have low blood pressure, and right now we have suboptimal hypoglycemia patterns, which is not good. So all these things need to be worked on. This is the foundation. These are principal foundation things that need to be worked on. I had a gal from Turkey. And she's actually just graduated medical school in Turkey, and her sister's in Canada. So she's in Turkey, her sister's in Canada. They're like mid-20s, and we did started to do these protocols, and what did we find on her? Low blood pressure. I cannot tell you how many women that have been damaged have low blood pressure, and it's completely 100% overlooked, like 100% overlooked. Blood pressure needs to be between 80 or 120 over 80. 80, that's the sweet spot. Why is blood pressure so important? This is what pumps blood and nutrients deep into your tissues. We're talking about tendon problem. Like if you have a tendon problem, tendons don't have good circulation. So we need all the pressure to push all the nutrients in there. Same thing with your brain. Your brain is very dense with nutrition. We need good blood pressure to push nutrients into the brain. Now here we also have some funny things happening right here. This calcium level is at 10.7. You can see the range. So this is elevated. Now, she also had labs, again, from October, and this was not elevated at that time. So something's going on. Like, this could be a possible parathyroid problem. So what I told her is we need to use some basic protocols for 6 weeks, the things that we're going to do, and then we need to recheck some of these things. This is concerning, right? So this is a problem that needs to be looked at and addressed because it's slowly getting worse. Now, here we have hemoglobin A1c, which is a 90-day marker, right? It's a 90-day marker for your sugar level. So this is actually really in the sweet spot. That's a really good marker. I like to see A1c between like 5 and 5.3 is a good spot. Now, we also checked here. I'm going to move down here. We also checked insulin. Now, here we have, let me show you insulin here. Let me find it. Here we go, insulin. So as your blood sugar goes up, insulin goes up. Now, look at insulin here. The range is 2.6 to 24. The sweet spot is around 5. So why is this a red flag for me? She's at the very low end of insulin. So she doesn't have a lot of insulin going on in her body. So again, this tells me that she's probably not eating enough. You need to be eating 6 meals a day. Her insulin is very low, which tells us that can be a possible hypoglycemic condition. So we need to address these things. We need to address these foundational things. So all this is in blood work, right? So we did one specialty lab, and that's for an autoimmune disease. We haven't got that back, but when that comes back, I'll keep you updated. So, this is concerning right there. DHA, which is the hormone, that's pretty good. The thyroid hormones, they look decent. Now, right here we have reverse T3. So this is a thyroid hormone, but this is reverse T3. So what the heck is reverse T3? Imagine it's like the brakes. So you have thyroid hormone, which is like go, 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 and then you put on the brakes. So reverse T3 puts on the brakes. So it makes things slow down. So when your body's really, really stressed out, which it is because all the damage that she's having and all this concern and worry, your reverse T3 starts to elevate. So So when reverse T3 elevates, guess what? Your normal hormone, this is reverse T3, your normal hormone can't actually get in a cell because the reverse T3 hogs it all up, right? I'm not sure if you have any dogs, but our dogs, they'll like instantly eat their food in like 10 seconds. Just imagine reverse T3 gobbling everything up, and then your thyroid hormone cannot work. So why is that? I don't know exactly all the mechanisms that we need to do, but I know that we need to do a polytherapy approach, and all these little things will start to get her body healing and functioning better. Here's vitamin D. You see this range right here? Like when you have damage, you need to be in the higher range around 80. Now, the good thing is her labs in October, she was around 33. So that has gone up. That's a good sign. C-reactive protein, that's an inflammatory marker, really, really good. None of her markers really show chronic inflammation. Well, let me go over this one right here. This is a homocysteine level. This is very important right here. The sweet spot for homocysteine is 5 to 6. This has to do with methylation. Now, if you haven't heard that term, okay, you can Google this, but methylation has to do with replication of DNA, right? So if you have high homocysteine, this is an analogy. If you have high homocysteine, it's like you're taking a copy of a copy of a copy of a copy on your DNA. So if I take 1,000 copies of my first copy, how's that copy going to look like after 1,000 copies? Not very clear, not very crisp. This is what high homocysteine can do. It can cause your DNA to be poorly copied. Now I'm connecting the dots here, right? I'm getting excited because these are the cases I see. If you're out there suffering, you can get help. Give me a thumbs up. Share this video, man. Put this on your Facebook group. Share this in the groups. People need to know this, connecting the dots. Seriously, like there's too much suffering out there going on right now in the world right now. It's just crazy. So far, what have we found? There's so many things we can found. I need to like start to write these things down so I don't skip anything. So right now, what have we found? We found one, she has white blood cell count elevated, right? She has low blood pressure, right? So that's not good. Low blood pressure, low glucose levels, which is not good. And then we also found homocysteine, which is not good. So homocysteine has to do with the DNA replication. So she's not replicating good cells. This is what's happening. So there's things that we can do to handle that as well. Here's another sediment rate here, which is normal, right? So getting back to the homocysteine, I have videos on this on my website. This is a critical marker. So we checked to see if she had any antibodies, any autoimmune disease against her thyroid. She doesn't. B12, look at this. B12 is at the low end. So now we found a B12 deficiency as well. I already talked about this, insulin. This is fibrogen. This is another inflammatory marker. So we can check inflammatory markers. These are just markers. If these markers come back normal, that doesn't necessarily mean that you're not inflamed. That just means that these markers did not detect it. Right, so we throw out the fishing net and we reel it in and see what we got. Now, homocysteine can be an inflammatory marker. Now, if we never checked homocysteine and we've seen all these other markers, we'd be like, well, there's no inflammation. There is inflammation. If you're out there listening, I believe you that you've been damaged. I believe that there's problems out there. Okay, I have videos on ferritin. This is decent. Now here's another concern that I have. This is free T3. You see this range here? So this is, the sweet spot's 3.5. So she's a little low. And the free T3 is your most bioavailable, bioactive hormone, thyroid hormone. So your body makes two types, T4 and T3. T3 is the most active. It's the most bioavailable. And how I remember that is 4 is bigger than 3. Okay, so 3 is smaller. So 3 can more easily get into the cell and more easily start to activate. Now, she also had high reverse T3. So we have T3, normal, free T3, which is right here. Then we have reverse T3. So we have suboptimal free T3, right, which is the most bioavailable hormone, and we have too much reverse T3. So what's going to happen to the fuel source? It's not getting there. So we've seen this all in blood work, right here in blood work. So there's lots and lots of hope and possibility for her. We checked magnesium RBC. Actually, this is in a really sweet spot. So anyway, I just wanted to go over this because, man, there's freaking too many people suffering out there. If you're out there and you're still watching this video, click the link below. Get a hold of me. You need some help, brother. There's too many people suffering, and they just need a guide. They need someone in their corner to help them get well. So with that being said, love you guys, and remember,